Welcome to RHI's Sociable City Interviews, where we meet with global thought leaders on nightlife and the social economy. Today we are here with Macarena Rau Vargas, President of the International Crime Prevention through Environmental Design Association. Macarena completed her PhD in Architecture and Urban Studies with a focus on the SARA model of policing. She has extensive experience leading urban and public safety projects in Chile, Latin America, and the Caribbean. As a leader of the International CPTED Association, she focuses on women's safety, including creating the CPTED Guide for Women. Well, Macarena, it's so great to see you. It's always fascinating to talk with you.
Thank you, Jim. The same for me. Thank you. Thank you for inviting me.
Mm-hmm. So why don't you just give a brief background of how you got to do what you're doing?
Well, I am Dr. Macarena Rau Vargas. I am an urbanist, an architect with specialties in criminology, environmental criminology. And I have worked for the past 24 years applying CPTED, crime prevention through environmental design methodology.
Oh, okay. And I know you're in Santiago because you and I visited when I came down there, but you've been in other South American and Central American and Caribbean countries, right?
Yes, I am based in Chile, in Santiago and other cities of Chile, but I have been elected president of the International CPTED Association since 2017. So because of that and my consultancy work, I travel a lot all around the world, mostly because of projects, applying CPTED projects in the complete Latin America and the Caribbean region, but also Europe, Asia, Africa, Canada, United States also, among others.
Now, I've always, people can read about CPTED, but I'm always fascinated when I'm with you and we go out at night, not only in nightlife districts, but also in the venues, the bars and the restaurants and stuff. And you always have a very special lens that you look through to see things that might pose risk. What is it that you find unique about applying CPTED principles, which from my experience is more often applied to residential or commercial areas, but more specifically to nighttime social areas?
I think CPTED applies very well in nighttime social areas because CPTED has to do with people, and people, mostly women, people are the thermometer of the environment. For CPTED, first, second, and third generation, because the methodology is in a constant evolution. So we have first generation CPTED that has to do more with the physical layout of the crime opportunity. Then we have a second generation CPTED that introduces concepts of social environment and social architecture, how we understand communities in a specific environment. And then CPTED third generation has to do with psycho-emotional understanding of behavior. That is very, very relevant. And at nighttime economies and districts, it is very relevant because people want to feel safe. They need to feel safe because it is dark the most of the time. We can have light, but when they go out of, for example, a disco or a pub or a restaurant and need to take a taxi, and if it is a woman, it is especially relevant that lighting is the proper lighting in public space.
What would be proper lighting? How do you make the lighting so that you still maintain that sense of night, but not necessarily make it so bright that you feel like you're in a shopping mall?
Yes, indeed. It's very relevant in CPTED. In the CPTED world, we call it the proper lighting, and the proper lighting to the activity that is performed. For example, if young women need to move from a restaurant at night to pick a taxi, we recommend to develop safe routes. And I have developed in many projects, also in Mexico, that is very dangerous, safe routes for women. That means not only light. For example, we design the complete route from the restaurant to the taxi stations, and we put proper lighting. Proper lighting means to avoid, for example, the zebra effect. The zebra effect is when it's not homogeneous, the light. It can be not very, very shiny because we are in a night life district, but it must be very homogeneous.
So rather than having lights that are staggered, that leave dark, shadowy spaces, there should
Totally.
be a continuity of light. It should be even.
Yes. Yes, that is the purpose. And what's happened, the most of the time, robberies happens in that part of the street without light. You can have light, and then there is shadow, and there is the crime opportunity.
So it's the shadow area that is the most risky.
Yes, but this is only very tiny example, because something that I like most of CPTED is that it's very comprehensive. It's a very comprehensive approach. So if you want to increase the security, the environmental security of an area, at night mostly, you need to look after lighting, natural access control, territorial reinforcement, and the perception of fear of people, and mostly women.
So now you're beginning to see more streetscapes that are designed where you're integrating different forms of modality, like bicycles and scooters, and then pedestrians, and then you add places where they want to get home deliveries, so deliveries come to pick up food from restaurants. So these are all variables that kind of combine that shape that physical environment that you're talking about. How do you see some of these types of physical designs becoming perceived? Because you talk about perception of safety is really important. But how does it feel for people to see almost what might become a chaotic environment because there's so many things that are happening? Is that a factor that you have to think about in planning from a CPTED perspective?
It depends. Many variables, as you mentioned, are part of daily life. After pandemic, COVID, we have so increased the deliveries, and we have so many people delivering food and things like that. So it depends. For CPTED, there is a concept that is very relevant, that is natural surveillance. The natural surveillance is the ability to see and be seen. So everyone can be a natural surveillance, and that is very relevant. So if you have many eyes on the streets, that is positive for safety, depending if they want to denounce, for example. But if we don't have many eyes on streets without denounce robbery, for example, it is not good. So it has much to do also with awareness and how people can help each other and how they can denounce. It is not only to see and be seen, but also what to do in case of a crime. If there is a call, for example, call button to the police that can react very quick, or there is a protocol, established protocol that people from delivery can produce when they see a robbery. So there are many things that we need to link.
So when you look at it from an environmental perspective, you're seeing not just the individual who may be at risk, but those who are capable of seeing the risk and being able to respond. So the environmental design that you're talking about is not just the physical aspect, but the ways in which the people, the eyes on the street, as you say, can become part of the environment of prevention.
Yes, we talk about capable guardians. guardians that are very relevant. We need to increase not only eyes on streets, but also capable guardians. Capable guardians can be formal, as guards from a restaurant or a shopping mall, for example. They need to react together with police. The ideal scenario is that they are linked with police, but also we can have capable guardians that are neighbors, but they need to be taught how to react.
How do you go about engaging people on this level?
It is very relevant, and for that purpose, conferences like yours are the best scenario to spread the word, as we say, for example, of the CPTED methodology, because the most of the time people don't know they are natural surveillance. They say, oh, really, I am a natural surveillance. Yes, they are, but we need to teach them what to do with the information. They need to call the police, or they need to have an app in the iPhone or mobile phone to make the denounce, or what. So we need to teach them how they can react in the case of crime scene or robbery or murder or rape.
So that this could also apply to inside the venues. I mean, does CPTED principles apply? I mean, it seems to me if you took your three standards of the physical environment, the physical, the perception, and what was the other you have?
The social.
The what?
The social environment.
The social environment. So you've got the physical environment, the perception, and the social. So what is the social? How does that translate? And how do you see that when you walk into a venue like a nightclub or a restaurant or a busy bar, and you look around, what are the principal CPTED strategies that you could see that would benefit the people that are patrons, the employees, the business? What are some of the things that you notice as soon as you walk into a place that it's not matching these three standards?
I remember when we were together in Toronto, in the night district of Toronto, applying CPTED and other strategies with your institution for a couple of years. And I remember when we enter a restaurant, for example, the first thing is natural surveillance. Also, it applies at night. We need to see if we can see very far or not. We have visual fields, for example, that are blocked. They are blocked internally by architecture, or they are blocked because we have too much lighting, or we can see also the toilets. Toilets are very relevant because much of the drug consumption and also traffic, micro traffic at night, goes into the toilet zone. So it's very relevant. And for women, women are special and unique thermometers for us of the environment. Why? Because women feel more fear than men. This is statistic. We have done many evidence and research about that. So if a woman feels safe in a restaurant at night, for example, the other community should feel safe also. So for that purpose, women must be thermometer, and women needs to feel safe when they come to the restaurant, internally in the restaurant, at the restaurant, and then in the toilet, for example, of the restaurant, and things like that. Also, we can combine CPTED strategies with the proper technology.
When you say proper technology, what do you mean?
Alarms, apps, but in the phones. I know very interesting cases of apps developers for very specific areas with denounce buttons that they have in the mobile phones, for example. And also something that happens at night when you have liquor, for example, your perception changes a little. So it's another perception of the environment. So we need to teach people how much liquor we recommend they can drink at night to feel safe, to can measure the space, for example. Sometimes happens that the more vulnerable victims are those who had so much liquor.
Now, you mentioned before that women have shown a higher degree of fear in their surroundings, in their environment than men. But a lot of times it's police and it's security in venues and they're men. Have you noticed that there are more women getting involved in policing or in security? And how do they differ in terms of the ways in which they perceive risk, and how do the women perceive them as being what you would call your guardians?
I am so happy. I don't know why, but no one's had written before a guide for CPTED for women, and I wrote a guide past year. It
Okay.
is, yes, I will share with you so you can spread it. The first CPTED guide for women. I have one copy in English also. It is so basic, so simple, because women eyes work in a different way than men. Because women feel what we call the altruistic perception of fear. What means the altruistic perception of fear means that the women feel unsafe by the women self, but also for the community that she takes care. It's something the women has more empathy. So because of that, she has a more groupal way of feeling fear. And with that sense of group, it's very relevant to work a strategy. And in that sense, it is very, very relevant also that we have more women in police force, more women in being guards of different venues, for example. At least in my country and in the Latin American region, we have each year more women working in safety. And possibly the possibility to apply that groupal sense of fear, it's very, very relevant.
Do you think that the perception of women, if they look and they see a woman guard, or they're walking down the street and they see a woman police officer, is that going to affect their sense of safety differently than if it was a big man at the door or a man police officer?
Yes, I think it will change the perception. My suggestion is to combine, because also a guard that is men is very useful. But for example, for a woman that feel fear of rape, probably it's more easy to feel protected by a police officer that is women, or can connect easily with that women that is police.
Yeah. Now, you wrote your doctoral dissertation, at least when the last time I talked to you, you were doing research on the SARA model. So can you describe what the SARA model is?
The SARA model was developed many years ago, connected with the POP, problem-oriented policing strategies. The SARA model, it's a very scientific model to understand the environment in the territory and to apply a scientific method to gather information and then to design a response. SARA is scanning, a comprehensive SARA scanning, analysis, response, and or the last one is the intervention, finally, of the area of work. And for scanning, we need to do a diagnosis. That is very relevant. In CPTED also, you do also a diagnosis. A diagnosis is like to take the picture of the crime phenomena in a territory in a moment of time with a specific community. You can do environmental diagnosis for crime prevention by day and by night, any time of the year. But if we research in nightlife areas or districts, for example, it's not the same a Monday, a Tuesday than a Friday or a Saturday. It's completely different environment. It can be the same place, but the environment can change totally. So the scanning part is very relevant. Then the analysis. the analysis part, the analysis is very relevant. Also, you need to cross variables. Yes, we have more crime or more homicide in this corner. Why? It has to do with the level of selling of alcohol, for example, or it has to do with the traffic of drug. We need to connect variables of the phenomenon, the analysis. Then the response is very, very relevant. How we will deal with that in the police area. We need to have more police designated to this specific crime spot or not. And then how we evaluate all the strategy.
All right, so it seems like there's an overlap, like you said, between CPTED and this analysis. And this analysis can uncover the need for better CPTED design. Because if, like your example, that a corner where there's drug dealing and it's poorly lit and it is close to nightlife establishments, then the way to address that might be to increase the light or to have more visible people on the street, add more activity in that area. And so you change the environment and then you reduce the opportunity for crime. Is that what you're saying?
Yes, they are super connected and they can make together, both methodologies can make synergy, and they are like cousins, like family.
Yeah.
They need to work together.
Yeah, well, this has been interesting. You've helped me to understand even more than what I did before about the CPTED principles and how it relates not only to the public space, but also to the venue space. And I'm sure we could talk a lot about this, but now I can see the SARA approach and the CPTED approach and how they are like cousins, that they're two tools in the toolbox. And it's really hard to use one without the other, because it would seem to me that trying to do an evaluation for CPTED, you have to use the same kind of process that you would in the SARA approach. So it seems
Yes.
like it's a very complementary tools, but they each have a different purpose. One that is much more specific to a series of crimes that happen. The other is to create a safer, more vibrant and accessible space for people to go to.
And also the CPTED methodology has what we call the CPTED DNA. That are the principles. For example, first generation CPTED has natural surveillance, natural access control, maintenance, and territorial reinforcement. This is the ADN of CPTED first generation. Then second generation introduces community participation. And third generation CPTED introduces the 4S of economical sustainability, social, health, and environmental. So this is the ADN. And what's happened is when we do a CPTED project, for example, we take care to apply these old principles in a project. The SARA methodology is not so linked to principles, it's more linked to process.
Okay, I understand. Well, that's a good clarification. I appreciate that. Principles versus process.
Or together, because of that, they are cousins.
They're cousins. Okay, yes. Well, this has been delightful, Macarena, and I hope to see you in Sacramento. And yes. I really enjoyed this conversation.
Oh, thank you, Jim. As always, it was a pleasure. I will be there, of course. I don't miss your invitations. Your conference are first class, so I will be there. Thank you.
Okay, well, thank you.